Greetings, friends and followers. This is Nurses Talking, and I am Dale Barzey. And as always, if you like what you see and hear, subscribe. Leave us a comment. Let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. Today, I have the very, very great pleasure of welcoming Soraya Zamor out of the United States. Soraya is a psychiatric nurse practitioner. She's a wellness writer. She's the founder of Soraya Writes and Soraya Health Writing Services, LLC. She's the author of multiple published books and mental health guides, and she creates journals supporting reflection, self-care, and resilience. Soraya says she contributes to platforms like Today's Nurse Magazine, The Nurse Magazine, Bradenton Magazine, and Recovery.com. And she helps women and healthcare professionals reclaim mental wellness through storytelling and evidence-based strategies. So, welcome, 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 Soraya.
Thank you, Dale. Thank you. It's an honor to be here. Thank you for the invite, and I cannot wait to share my insight and value with all of you here. Thank you so much.
My pleasure. The honor is mine. Speaking to nurses is something I've wanted to do for a long time. So,
Thank
but
you.
anyway, first of all, what brought you to nursing?
So, what brought me to nursing? I remember I'm from Haiti. I was born and raised in Haiti, and I came to the US in 2009. And I started working with elderly patients. And I'm very sensitive, I'm very kind, and I developed that compassion, that love to serve other people. So throughout my journey, I felt like, you know what, I'm gonna be a nurse because the level of, I would say, the level of relationship, the bond that I've created with my patient, and many of them, they kept saying, you have to be a nurse. You have to be a nurse. At first, I wanted to be a social worker. And later,
Mhm.
you will see how life has been so good to me because I wanted to be a psychologist in order to become a
Ah,
therapist.
yeah,
And
yeah.
now when people they were like, you have to become a nurse, you have to become because you are so good at what you do. Even the nurses that I was working under, and at that moment I was like, that's it. I'm going to nursing school. I'm gonna put my heart, my soul to it, and that's what I did.
It's something though, when other people see something in you that is somewhere inside you that you haven't yet blossomed yet. And they keep telling you, yes, I see this, yes, I see this. It's
Yes,
something.
yes,
But
yes.
what were the challenges for you though?
The challenges for me, it's because of I came from a background where I was in accounting at my very early like 20s. I started
Mm,
to work as an accounting and I came here I was like 20 to 24. So
mhm.
for me to switch from accounting to a nurse was different topic because one thing that people they don't like biology wasn't something that I really liked. So, so this was the first challenge that I faced. But the more that I was diving into the curriculum of nursing, I was able to overcome every limitation that I had. And I ended up doing successfully in the nursing program and graduate with good grades. So this was my challenge, yes.
That was your challenge, a new challenge.
Mhm.
What kind of areas did you work? I know you said you started out in long-term care. What other areas did you work?
Or I've worked as a case manager.
Mm-hmm.
I've worked as clinical care coordination. I've worked as a nurse manager. I was a state map coordinator, and I also did like some VNAs, nurse education. So I've worked in many fields and area on my nursing journey.
And so one of the reasons that I ask people that particular question is that I want nurses to know that there are so many areas you can that
Mhm.
and we all the thing with that is that we all many of us anyway explore many of those areas where we actually find our niche and what suits us. But we have the opportunity to do that.
This is a very broad and huge profession. I remember when I studied as a nurse, I did a little like bedside and I was in the RIA, but my family, the only thing that they know about nursing was bedside.
Yes.
Yeah, that was the only thing that they know. And when I started doing public health nursing, and they were questioning me but one thing that they didn't realize, I was making way more money than people working in the hospital. And I love what I was doing and the
Mm,
level of expertise that I was bringing to my field and be as valuable than the one in the hospital was
mm,
equal. But people, they
mm-hmm.
are very limited to what they know about nursing. Because
Yeah.
what they know, it's all about like hospital, wound care, wound vac, but they don't see like the care coordination team. They don't see like the case manager, the one who are educating people, the one who is in the community making like boss move. And now we have a new field, nurse entrepreneur. As I'm a nurse
Yes.
entrepreneur, I'm a
Yes, you are.
writer. I've worked for many magazines. I've worked in the administrative field. So many things that I've done as a nurse. And I feel like even for my friends, those that are graduate college, they said like, oh my God, Soraya, you bring so much innovation in the way that we see nursing that we didn't even know that exists.
Yep. Yep.
Yes.
Yep. Yep. And that's why I do this because nurses need to know. Nurses need to know you do not have to be stuck. You don't have to stay and you can work at the bedside and like you work as a writer and you can do so many things with
So
that
many things.
license that you have.
So many things.
It's like it's a license to do anything.
License to do anything. You are not
Anything.
stuck. You are not stuck. You can be in the office. I can be on my couch. I can go back to the hospital if I want to. I can be
Mm-hmm.
in the community. I
Mm-hmm.
can do in the education field so many things. We do
Yeah.
informatics, many things that nursing can do.
Yeah.
Yes.
Indeed.
Yeah.
Indeed. Indeed. So then, with all of this experience that you have, what made you choose psychiatry? You said you wanted to be a psychologist before.
Yes, yes. And I'm very thankful that nursing gave me the opportunity to merge both. So after I did a little bedside, little rehab, I was working for a human services company, one of the biggest human services company in Massachusetts, Elliott, and they have the MH mental health division. So I landed position there. So when I started working for the respite under the adult clinical community care services, so these they were patients with mental illnesses.
Mm-hmm.
But one thing about me, when I was in nursing school, mental health I was acing mental health. The grade that I was having, even the other student, when we work in the psych ward, they would say, these are Soraya's people because the patient they love me and I love them. And energy doesn't lie. When you get to a space, the space identify you.
Yes.
Even the other student, even my professor back then, her name is Andy Filippo. A couple of years after I graduated, she sent me a message. She wanted me to come and teach at Salem State in the psychiatric mental health program. She gave me a book because she saw the mental health nurse in me as I was in school. And the
Yeah.
student kept saying it, but what they didn't know, I said, this is my field. I wanted to be a psych nurse. So yeah, people find it very odd. Even my friends, I was like, "What is the difference between you doing maternity, being a cardiac nurse, being a wound nurse, and psychiatric nurse? We are
Yeah.
doing the same thing."
Yeah. 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 Yeah.
Yeah.
All of our patients have a need, and that need has to be met, and it has to be met
Yes.
by someone who has the ability to meet that need.
Yes. Yes.
Yeah.
And here I
Yeah.
am. I landed in psych, and I love it since then. I love it,
Okay.
and
All
psychiatric loves me too. So.
right.
And the last good thing now I can live my childhood dream to become a psychotherapist and be able to prescribe medication as a
Mhm.
psychiatric mental health nurse. So now I'm
Mhm.
having the best of the both worlds.
There you
I was
go.
able
There
to
you
merge
go.
my dreams and still be a nurse. So I win at the end.
Yes, yes. And that is the thing with life, you know.
Yes,
If you take the steps, it kind of guides you and into where you really wanted to be.
yes,
You just need
yes.
to take the steps.
Take,
Yeah.
need to take the steps one step at a time.
Hmm. Hmm. What though do you think you would like to see change? Because I can see, as you talk to me, I see you as a nurse who's full of joy and full of, love for this profession that you do. But what would you like to see change, if anything?
If there is one thing, it's to reduce the burnout in the nursing profession, especially for those who are working in the hospital space. I do a lot of mental health advocacy and I advocate for my fellow nurses because many of them, since prior to COVID, passed down to COVID, and now they are still struggling. And there's this level of increase of mental illnesses in the nursing field because of the abuse, overwork, and the nurses, I feel like nurses, they don't take care of themselves enough. So what I'm hoping, like for policymakers, for those who are able, to create laws, to look at the nursing profession like on another level, because for me, I'm very fortunate that I can have my laptop, be home and work as a nurse. Many of my fellow nurses, they are stuck inside of the hospital working for 12 hours.
Yeah, exactly.
Yes,
Exactly.
and those long-term care, they don't pay those nurses enough. And I'm advocating for the RNs, I'm advocating for the LPNs, where they give them 20, 30 patients because we have a shortage of nurses. So I'm advocating for nurses to be free from burnout,
Yeah.
so
Yeah.
we can reduce their level of stress, of anxiety, because many of them, they are fulfilling many roles. They are wives, they are mothers, they are sisters, they are cousins. I feel like the burnout in nursing is so real. I hope that people, they can hear that conversation and do
Yeah.
something about it.
It is real. It is real. And you talked
Yeah.
about the roles that nurses fulfill, but that's the life roles. Even in the workspace, they fulfill many different roles. They fulfill the nurse role. Have you ever, if you've been in any sort of institution for any time, the minute something happens, somebody says, ask the nurse or call the
Yes.
nurse. It doesn't matter if it's a nursing role, if it's a housekeeping problem, if it's a problem with the copier getting
It
stuck.
was so real because Saturday I had the opportunity to teaching some student in Nigeria.
Mm,
And we were talking about nursing. Well, it was a World Patient Safety Day, and we were talking about evidence-based practice in terms of
yeah,
safety. And I told them, we nurses, we are the center. We collaborate with so many other, like
yeah,
doctors,
yeah,
therapists, so with so many other professional. And as a part of the care team, you just said it right, as the nurse.
yeah. It's the
The
nurse.
OT will call. I remember when I was a case manager, the OT will call you, the PT will call you, the PCP will call you, any other specialty doctors they have, they will call you.
Yeah,
It's on us. The CNA will on us. The LPN will on.
yeah.
We are the eyes of the doctors. We spend more time with the doctors than anybody else. If there's a med error, it's on us.
It's a
Everything
nurse.
is on the nurses. And what you said is so important. Housekeeping issues, someone for as a nurse.
Ask the nurse. I'm telling you.
So many things that we care. I remember back in respite when they come to the hospital, and prior to the hospitalization, they will come with a med list, and you will see so many side effects, and those medications should be discontinued. Now they have an anxiety or a panic attack or MDD. We send them back to the hospital. As they get inside of the hospital, they come back with the same medication that was discontinued. And I was like, between the prescriber, inpatient, and those who are working outpatient, do they ever have a conversation? So
Right.
here I am, I have to call the outpatient provider and ask them to discontinue. So that's why our role as advocate is very important,
Mm-hmm.
because we are the
Mm-hmm.
one catching up these errors.
Yeah.
We are the
Yeah.
one reviewing those dosage.
Mm-hmm.
Everything is on our shoulder. That's why
Yeah.
I want, like, nurses, please care for yourself.
Yeah.
Please care for
Yeah.
your mental health.
Yeah. 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 So you brought up this, caring for ourselves, and typically I kind of bring that at the end of the conversation, but let's talk about that now, because you're talking about people paying attention to this. From my perspective, I really think that paying attention to this starts or should start in nursing school.
Yes.
Most of our education prepares us to take care of other people. And that is what our profession is about. But
Mhm.
somewhere in that education, we should recognize, our education should recognize that taking care of other people involves taking care of us. Because if I haven't taken care of me, I cannot adequately take care of you. But it
Right.
doesn't recognize that, or it
No, it
doesn't
doesn't. It
teach that.
doesn't. Because I have nursing friends who are working in the hospital. I remember one of my friends, she told me up to now, she's still having like symptoms from COVID-19 because she was diagnosed many times during COVID because they were running short out of nurses. And one of them, she sent me a picture. She has a hole.
Mm,
She was pulling her hair of
yeah,
anxiety and stress. So unfortunately, we don't have that in our curriculum in,
yeah,
in the school
yeah,
system. We don't have that. But there is a burden that as you are a nurse, you have to carry the load of everybody else except, being care for
yeah,
yourself. And
yeah.
as you go home, our task never ended.
What
You walk
ends?
inside of the home, you have the children waiting for you, you have the parents who are getting old. Some of us, we are in relationship, we have partners. So these are all the responsibility that one person is carrying, and we need to start really advocating for our
Yeah,
nurses, to care for
yeah,
themselves.
yeah. And it no, I have started to frame it in a very selfish way. And maybe if we frame it in a selfish way, we might do something about it. Because I say those nurses have to eventually take care of me at some point. you know?
Yes.
And if they're not able to take care of themselves, if they're not well enough to take care of themselves, they're not well enough to take care of me. And so I feel like if we look at it like very selfishly, and so we need people who are able to take care of us so that they can take care of themselves so they can take care of us, maybe we'll do something about it.
We'll do something about it. Yes, we'll do something about it because, yes, it's very important that we emphasize the need for nursing to care for themselves because when they show up in the workplace, I remember I was a nurse manager in assisted living. It was like years ago. And the nurse who spent the overnight, she was so tired. What I usually do as a nurse manager back then, when I worked, I was an RN. I usually do my round before anything else. So she gave me a report, she left. And when I walk inside of one of the room, the patient was dead. And I didn't put the blame on anybody. I was able to handle it because he was very sick. He was a cardiac patient. But one thing that I've understood, it's like when you give someone so much to carry, so much to carry, these are the consequences of it.
Mhm. Some things
Because
don't fall through the cracks.
yes, so much to carry. And she's the one, as a professional who carry the expertise. There is that detailed assessment that needs to get done if you are working with a COPD or a cardiac patient, or let's say
Mm-hmm.
we have a wound vac, a complex wound. So we cannot rely on the understanding of an LPN or a CNA.
Mm-hmm.
So please care for our nurses because like sometimes I feel like it's too much for them.
Yeah, yeah, yeah.
And I advocate for her to get like 2 days off
Mm-hmm.
so she can process of what happened. I know some other nurse manager could have put the blame on her, but I feel like as a team we need to support each other. I was coming from home, I had a good night's sleep.
Mm-hmm.
I just
Mm-hmm.
show up on a Saturday morning for somebody else, probably like after taking care of her children, getting up and show up on the floor at 11 p.m.
Yeah, yeah.
and work all night.
And
So
work all night.
advocacy is pretty big, and I highly encourage the managers, the policymakers, and you add one more client that I need to add. It's
Yeah.
like the school.
Yeah.
Yeah, add that into the agenda to let the nurse know it's okay. It's okay to rest. It's okay
Mm-hmm.
to take. It's okay to pause.
It's okay. It's
It's okay to
necessary to
pause.
pause.
Yes, it
It's
is.
necessary. Mm-hmm.
This is
Mm-hmm.
yes.
So right, I have seen over the last 15 years or so, so many changes in nursing. So many changes from tech to the way it expands to entrepreneurship to all kinds of things. What do you think you see if you look ahead 10 years or so? What do you think you see coming down the pike?
So what I've seen, it's like as many of us see how we are getting to higher level of education. I
Mm-hmm.
feel like we are getting to a point now where if we don't bridge the gap between where we at one point the profession will,
Implode.
yes. Because now many of my friends, we are NPs, and as I'm crossing to become a doctor, my position is vacant as an RN.
Mhm.
And
Mhm.
the school doesn't make it easier for people to get into nursing school.
Mhm.
Prior for me to become a nurse, there was nursing shortage. During COVID, we were running out of nurses. And I don't know if you realize many nurses, they have left the profession after COVID.
Yes. Yes.
Many died,
Yes.
many
Yes.
burnt out, many have left the profession. And because as what you said, there is an involvement, so many things could be done as a nurse. So there is that huge gap between like being an RN, LPN, higher education in nursing from like NPs, MSN, and doctorate. And once you get to
Yeah.
the doctorate level, that's when people they start diving into education. We are
Yeah.
writing books and we are working, in administration and we are building our own enterprises.
Yeah.
So that's the thing. I feel like if we don't fill this gap, the system will suffer because there will be a bigger shortage of nursing.
Mhm. Mhm. I see
Because
what you're
once you
saying.
become a nurse after 5 years, so many opportunities. I remember one time someone called me to become occupational nurse. I
Mhm.
was like, what? They were looking for OCHA nurse. I was like,
Mhm.
what? There are
Yeah.
so many
Yeah.
opportunities out there, and the shortage is real.
Shortage.
Yeah, even in university where I attended for my master's, they were looking for someone to teach fundamental nursing. They could not find because those who are professional, those who have been working, they are so busy working on other things that
Yeah.
even education. So can you imagine for long-term care?
Yeah.
Who's gonna care for our elderlies?
Yeah. Yeah.
Yeah.
Yeah. Yeah. And right now, that's where the critical thing is that, nurses in long-term care, A, don't even get the chance very often to for adequate or proper continuing education
Yeah.
because they have 30, 40 patients
My
that they're
God.
taking care responsible for in any given time. Who has the energy
To
after
study
that
after
to
that. No,
yeah.
no.
Having done all that you have done and seen all that you have seen, what advice do you think you'd give to someone who wants to be a nurse?
Oh my God, we are waiting for you. It's such a beautiful profession. And the reward to see people getting better and the reward to know that you are making a difference in the life of others. One thing that I've learned, like people, when they wanted to be a nurse, it was all about the money. But I can tell you, the reward that you get, it's seeing patient condition improve. I remember I used to be a case manager, one of my patient, George. Whenever she get to see me, there is hope because he had so many things to say. I could see George today at 4 and I show up the next day at 8 a.m. He always has, he felt, sometimes people, they felt secure when they see you. They know
Yeah,
that you are bringing values. You know what you are doing. So mostly like I will tell you, this is a wonderful profession.
it
This
is.
is one of the best profession in the world. You get to care for other people. You get to advocate for them. You get to talk to their family to tell them everything is gonna be okay. I have moment. I remember I witnessed people dying, and I have to hold family's hand. And I have to give them a hug. But guess what? It's all rewarding. So please get on board. It's such a beautiful. Don't be scared about what you heard other people they have experienced. I know so many people they left the profession because
Mm.
of COVID, because of burnout, of abuse. But trust me, you're gonna love being a nurse, and you are very well respected when you're a nurse too, especially when you're a good one. You are
The other
making
thing
difference
about
in people's
nursing,
lives.
the other thing about nursing, Soraya, is, or at least I found it so, is that it teaches you who you are.
Yes,
You
yes,
thought you knew who you were,
yes.
but it teaches you who you are.
Yes, it's so true. It's so true. You're gonna know the how much you can carry, the level of emotion that you have inside of you. You're gonna know your level of compassion. Yeah, it definitely can push so many emotion out of you. And I
Yeah.
love it. And I really love it. I remember one day I was in my office very late on a Friday night as I was teaching, um, and someone OD to I would say 2 minutes from my office. And for me to witness a thin line between life and death, and we were able to revive her. We called the
Mhm.
cop and took her out. And 3 days later, she came to my office and said, "Thank you." So when I was leaving my workplace that night, I was shaking. But one thing I said to God, I'm thankful because I stayed that late to teach one of people that was supervising, because I was the nurse manager there back then.
Mhm.
And without my expertise, probably she would have died. But because I was there, I made the appropriate assessment and I provided the required
Appropriate.
care for that
Yeah.
patient. And
Mhm.
now she's alive. So really, when I get home, I was sobbing, I was crying. I was so emotional. I spent the entire weekend being so emotional. But on Monday, when she came to my office and I was able to hug China, and I said, "God, thank you. Thank you that I chose that profession."
Yeah. 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 So we talked a lot earlier a little bit about we brought up self-care. And so I have to ask you, what do you do to care for you?
Oh my God, so many things. I'm a world traveler. And I love Broadway, Boston. I will go for a walk. I love standing comedy. Oh, I love Boston Ballet. I live in Boston, Massachusetts. Oh
Uh-huh.
yeah, I'm very good at that. And I have like a good circle of friends who go to restaurant. I dress up. So listen, I do so many things. Like last weekend, I was in Maine. We were by the lake. We were kayaking. I was with my family, and I travel a lot. And I
Hmm.
read books. And yeah, so I have a wonderful support system. Please, people, care for yourself. I will never
Indeed.
advocate for something that I don't respect. And I'm the lady, with the glasses. I do my hair, I do my nails. So I make sure that I feel good about me.
Yes, absolutely necessary, though.
Yeah.
Absolutely necessary. And when you do that, it shows in the way you show up to
Yes.
take care of others. It
Yes.
shows. It
Yes.
shows.
Yes.
Soraya, thank you so, so,
Thank
so
you,
much for
Dale, for
being here
having me.
today.
Thank
Is
you.
there any last words you'd like to leave us with?
Yes, I will say, yes, I will say like nursing is a beautiful profession. And if you are trying to get in, it can be very difficult depending on where you are, but do the work. Do the
Yeah,
work. And as you are becoming a nurse, knowing that your dreams are valid, they are possible. And they'll said something very important, as long as you put the work. One step at a time, I'm living my dream. I was able to merge nursing with psychiatric and I love it. And please, if you wanna, don't be afraid. Don't be afraid. You're gonna love being a nurse. And thank you for you, Dale, to give me the opportunity to come and share my insight here today.
my
Thank you all.
pleasure. My pleasure.
Thank you.
All right.